can hear you.
We are with you.
Okay, right. So I was again just like yesterday, I was trying to teach him that first landmark. As soon as we go into the stomach, a first landmark is liver. Once he has identified liver, liver is a big structure. Without going into the details of the liver, he needs to jump his station from liver to the aorta, and from aorta to celiac artery, from celiac artery to pancreatic duct, and once he's there on the pancreatic duct, he needs to do his detailed evaluation of the liver, of the pancreas. So I'm going to give the endoscope to the candidate. Naam kya?
Shakir.
Dr. Shakir. Okay. So the point that I was emphasizing, that as a beginner, he needs to forget about the structure that he's seeing in the liver. So it's a liver, fine. Our target is to evaluate the pancreas. So without going into details of the ducts and the vessels that we see in the liver, he needs to identify something big like liver, turn clockwise, because he needs to learn the maneuver, and as a beginner we need to learn the maneuvers. So liver, so slight pullback, and we need to identify the interface between the heart and the liver. That's, we need to identify the diaphragm, and as well as he identifies the diaphragm, he needs to turn clockwise and go towards the to the aorta. So you need to turn. Okay. Now here you have the aorta. You want to confirm the aorta? Just put in the flow, right? This is the aorta. It's a big vessel. Now slide along the aorta, go down. You're going to see the first takeoff of the vessel, which is going to be, and all the time, just a little jiggling movement like this, and you'll keep the aorta under your vision, and slight push, and there you have the the celiac artery right underneath your transducer, and this getting divided into common hepatic and splenic artery. And slight push further, and we land straight onto the pancreas, which is hyperechogenic, salt and pepper appearance, hyperechogenic, with lots of strands and echogenic foci. And right in the center we have pancreatic duct. And once the pancreatic duct is there, he needs to place the pancreatic duct right at the center of the transducer and starts his evaluation counterclockwise as clockwise. Once he goes to the clockwise, he's going to go towards the tip of the towards the tail of the pancreas, and he needs to trace the tail in between the kidney and the pancreas. So tip up and clockwise rotation, slight pullback, and continue rotating towards the right. Okay. Now you see that right here we have started to see the kidney, and on this side we have started to see the spleen. So just a jiggling movement right and left, and you'll be able to make out the things in a better way.
Can you hear us, Professor Gas?
Yes.
So I just want to congratulate Dr. Shakir already, since compared to yesterday, less air, he's not putting air in, he's up against the gastric wall, and his movements have picked up some speed. So shuru mein learning ka hota hai where you're very slow, but as you get better at this, you start moving your shoulder faster. So I'll just encourage him to do that, continue to move that left shoulder left and right, ताकि movement ज़्यादा हो, and then you just maintain your organ in view.
Okay.
But
Point well
already
taken.
doing better.
No, he's doing very good. Except one thing, that he needs to keep his finger away from the air and water button.
Yes, we
Just-
saw
just
you
a small,
moving his
subtle-
finger away.
Subtle movement, just a subtle movement. Okay, so clockwise rotation. Okay, once you're lost, go back to the previous position. Don't waste your time in looking into the structures which are not making sense. So if you're lost, go back to the first position, learn to maneuver to the previous station in a quick fashion. So you're back at the liver, and you can see the beating heart right on top of the diaphragm. So turn clockwise, move your shoulder and your body, and keep turning to the right, clockwise rotation, and slight pullback, slight pull back. Okay, okay, good, 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 good. There you see, and slight jiggling movement,
Okay, sir.
and there you go at the pancreas, right? Once at the pancreas, you need to once again identify the pancreatic duct. Learn to identify your landmarks. Unless you are identifying the landmarks, you are going to get lost very quickly. As a beginner, it's very important to jump from one landmark to another landmark and make your assessment as per the landmarks. No random assessment needs to be made. So bring the pancreatic duct underneath your transducer, and now once again start turning clockwise, big wheel up and slight pull back. Slight pull back, right? Big wheel up towards you, big wheel towards you, pull back and clockwise rotation, and you see that you start to see the kidney here and you have the spleen here. This is the kidney and this is the spleen. Okay, and you need to bring the tip. So you need to pull back slightly. Pull back, pull back, pull back, pull back, pull back. You see, okay. Now you see you start to see the top of the kidney. Okay, and just a jiggling movement. Now halki halki, choti choti choti, बहुत ज़्यादा नहीं. Small movements. Okay. Now as such, we don't see something coming in between the spleen and the kidney. Slow, subtle movements. Easy, easy movements, slow. And you need to step back. Okay, now that was a little better. Right? And if you don't see, go back to the previous station. Slight push and go back to the previous station, previous place. Once again, go to the pancreas. You save the liver, turn clockwise, identify the aorta, identify the takeoff of the celiac artery, and slide along the celiac artery to the pancreatic duct. Push, push along the aorta, just a jiggle movement so that you need to keep the aorta right underneath your transducer. Slide along the top of the transducer. So just, okay, there you go. And right here we have the pancreas. Now you're going counterclockwise?
Yes, sir.
Okay. In again counterclockwise, you're not supposed to push. Keep the, where's the, this is the pancreatic duct.
Okay.
So pancreatic duct is right there underneath your transducer. Keep it there, right? So unless the pancreatic duct is visible to you, will not be able to make any sense. Now you see over here, kindly maintain this position. Right here, you have the pancreatic duct going down towards the head. On this side, you have the portal vein. So slight push. Now you see, you are able to make out that this is the portal vein. Confirm that this is the portal vein. This is the splenic vein on this side. Okay. This is the splenic vein right here. This is the splenic vein right here. This portal vein becoming confluent, sputum is direct vein joining it. And this is the pancreas, the pancreas going down in parallel to the portal vein.
Okay.
And we are heading there. And over here, beyond the portal vein, you are going to have a slight glimpse of the CVD. Okay? Just think that you're going around like this. Stomach is a very compact area. So this is your station 1. And these are things that you're basically looking for at the station 1. Now you need to go to the D1. And up till now, other than the stranding and increased aqueous density, there's nothing. Okay, just you need to insufflate small amount of air, don't over insufflate the air. Push, pull, that's going to bring the endoscope in line with the pylorus. So you're not supposed to push it straight. Push and pull back, push and pull back. And then that's the way you go into the pylorus with a stiff head without any difficulty. Okay. Now, where's the pyloric opening? That's the pyloric opening. So push and pull, push and pull. Even if you have seen the pyloric opening, usually tendency is to go straight to the pyloric, but push and pull. This is going to keep you straight, and an easy intubation of the pylorus is made. Okay, very good. Go straight. Okay, now stop insufflating and suck out all the air. Suck out all the air. Change the position of your fingers.
Okay.
Now, use just index finger up and down. Okay. What will you like to identify? The structure
portal
that is portal vein. So where is portal vein? If the portal vein is not visible and liver is visible, that means that you've gone a bit too far inside. So come back, and intubate once again. And the moment you go inside the pyloric opening, that's the time that you should be able to look at the you'll be able to visualize the portal vein. So once again, with long scope in, don't go too far in, and now suck all the air. No, that is the thing. It's the liver parenchyma. So you need to be little proximal. So let me show you the maneuver. Once again, I'm not using my other fingers, just these two fingers. So pull back. There you go. Okay, this is portal vein. So you need to identify, you need to know how to identify the portal vein. So the moment you've gone inside, the first big structure with a flow of the blood should be portal vein. On top of that, most likely we have the CVD. So generally, okay. So try to bring the portal vein once again. About to be 9.5. Okay. वो बीच में मैंने भी टेक ओवर किया था. केस कितने बजे बंद करना है?
Sir, so the idea is that the faculty takes over after 15 minutes.
नहीं वो तो ठीक है कि बीच में टेक ओवर भी करना, इसलिए मैं कह रहा था कितनी देर में हमने टोटल केस कितनी देर में ख़त्म करना है to next.
So I'm switch कर रहे हैं जी to the next case.
Okay, are you switching to the next case?
Yes, we're just going to hear about the next case.
Okay, right.
Thank you.
नहीं देखो चीज़ once again, देखो जैसे ही आप जाते हो, ये है ना ये, we are going in with the long scope in.
Okay, sir.
There you go. Okay. What I've done? Just change the position of the endoscope. So big wheel up. On this side we have the pancreas. On the left side we have the liver. So just a small movement, and you're able to go to the point of your interest. And once at the portal vein, you need to identify the spumomesenteric vein as well as splenic vein. So on this side you have on the upper side you have the spumomesenteric. On the lower side you have the splenic vein. And on top of the spumomesenteric vein, as per the anatomy, you know that you should be having the pancreas. And what do you see in the pancreas? And what will you like to see in the pancreas? It's the pancreatic duct that you like to concentrate. Over there we can see that some kind of a tubular structure is there, parallel to lines. Now these two parallel lines, most likely somebody has placed a stent. And just 1 to 2 millimeter below that, towards the spumomesenteric vein, you have some hypoechoic linear structure, which is most like the pancreatic duct. Okay? Now, try doing it again. Yeah, very good, shabash. Excellent. So, identify clearly. Now, this is portal vein. You need to show me the spumomesenteric vein. Big wheel up and slight rotation and pull back. Okay, now very good. Excellent. On the right hand side, like this, there's spleen mesenteric vein. So big wheel up, big wheel up, 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 up. Okay. अच्छा उसमें ना हल्की हल्की ये
ठीक है सर ओके
दोबारा करो, पहले वाला मैंने हुआ मेरे ख्याल ज़्यादा पुश हो गया या पुल हो गया. हाँ गुड. जेंट हाँ ये दैट्स इट गुड. नाउ बिग व्हील टुवर्ड्स यू. नहीं नहीं देखते हुए स्ट्रक्चर को अंदर अंदर रखते और उसको गायब नहीं होने देते फिर अपने
ठीक है सर
ये. ओके ठीक है.
ओके
आर यू एबल टू मेक आउट.
यस सर
और स्ट्रक्चर गायब ना होने दो. सक 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 सक. ये गलती से भी ना अपनी
Okay,
फिंगर
sir.
अपने
ठीक है,
इस
sir.
फिंगर को यूज करना बंद
ठीक
करो
है,
क्योंकि unknowingly your finger goes into the air water channel and that's the reason that you start seeing the lumen. You should not be seeing the lumen of the duodenum. That's something which is undesirable. Chalo, try again. अच्छा समझ नहीं आ रही, come back. Never hesitate to go back again. जब आप करना शुरू हो जाओगे ना then you'll learn everything very quickly. वापस आओ फिर जाओ. ठीक है. अब देखो पायलोस कहाँ पे ना. ओके हाँ ठीक है. ठीक. go in go in go in go in go in go in. शाबाश. go in. Okay. Once again. Okay. Now same. You see you are right there at the portal vein. That's what you want to do. Portal vein, splenic mesenteric, splenic vein. On top of the portal vein and splenic mesenteric vein, you have the pancreas. So दोबारा इसको identify करो because in order to go to the pancreas, it's very important that you identify the portal vein very clearly and splenic mesenteric vein in a clear fashion. तो बहुत अच्छा आपने एक दफ़ा दिखाया मुझे. Very good. You're doing well. शाबाश. Very good. सक्शन सक्शन एयर बीच में नहीं होनी चाहिए. आपकी ना एयर बीच में है. अच्छा ये जो ऊपर से आपको आ रहा है ना शेडो, ये मोस्ट लाइकली कोई स्टेंट है जिसके शेडो है जो मैं पहले आपको दिखाया था कि हाँ ठीक है. मे बी कैलकुलस, मे बी स्टेंट which is giving you the shadow, but important thing is that this is the area that you are interested in. अभी आप हल्का सा कोई हाँ पैंक्रियास को देखो. पैंक्रियास कहाँ पे. अभी आप ना थोड़ा सा लॉस्ट हो. यू आर नो मैंस लैंड. ये देखो ये चीज़ ना यू नीड टू आइडेंटिफाई दिस थिंग. ठीक है.
ओके सर
Unless you have identified the port vein, you will never be able to make out anything. अच्छा उसके ऊपर देखो ये जो है there is some kind of duct. Now you need to make out what kind of duct is this. Right here we are very close to the hilum of the liver. So our area of interest is on this side. This linear structure which is giving echogenic and some hypoechoic thing is there. This is basically some kind of stent. Now we are not sure that this stent has been placed in the pancreas, this stent has been placed in the pancreatic. But if at this station a stent is going in this direction, so most likely it is going in the pancreatic duct. Had it been going towards in this direction, I would have said that this stent is going in the CVD. Okay. So trace it. जो भी चीज़ मिल जाए उसको दाएं और बाएं आपने ट्रेस करना होता है. ये सबसे इम्पोर्टेंट चीज़ है. उस स्ट्रक्चर को, उस चीज़ को आप अपने ट्रांसड्यूसर के नीचे लेके आएँ. टिप अप, टिप डाउन,